So I've had scoliosis since I was a teenager, and I'm 47. I'd say the last 2 years, it just started getting a little progressively worse. Getting a little bit older, I'm finding I can't rotate in certain directions, and I'm getting a lot more back pain. Hi there, I'm Jill, and I'm a patient here at PTSMC. I've had a couple periods of months where I just can't even bend over. I couldn't tie my shoes for 2 months. It's just, and then I'll work my way out of it, but it's frustrating, and I've definitely found myself complaining much more frequently about back pain. I've just done everything that I feel like I could do. I exercise daily. I do a lot of stretching, yoga. Been going to the chiropractor weekly for at least a decade. I've tried a little bit of acupuncture and some massages too. I looked into surgery for a little bit, and it seemed like a good idea until I did more research. I went online, I was just looking for alternative methods for physical therapy. I looked at the Schroth method, and I thought to myself, how did I not know this existed after all the research that I've done? And then I found that there were very limited providers. So I was very lucky to find you guys were in my area. So I was kind of excited. And coincidentally, my physical therapist is actually my father's physical therapist, so it worked out well. So normally I come in, I usually warm up on the arm machine. I hang and we do some stretches and just, minor breathing exercises. See, my physical therapist will change up some of the exercises in the routine to see what kind of works. And then usually towards the end of the session, we'll get a small massage on those muscles. And it's interesting because it's usually the other side that I would normally massage. So I've learned that, to kind of relax different muscles. My physical therapist has definitely made me more aware of the way that my spine is constructed. I have a better concept of the way that it rotates and how to use certain muscles to try to fix my posture and relax some muscles and try to get other muscles activated. As I'm noticing now that my head is tilted, and she's always telling me to go the other way, so that's one example. So yeah, I try to apply that in daily life. I notice I do this a lot, and so I make slight corrections now that she's brought things to my attention. My physical therapist, Dana, and I actually have a common background. We both did gymnastics pretty competitively as kids, so she can definitely personally relate to, I guess, the concepts that I have, how I was trained. I was trained to hold myself a certain way, stretch a certain way, and it's really interesting the things that she's taught me, and I do trust her because of that. I definitely have a different level of trust because she understands it personally. Hands down, I would absolutely try this. I think especially if someone is a teenager, I think it can make a massive structural improvement. I wish that I had known when I was a kid. As an adult, I do think there's definitely, I think it could help a lot. I think it could improve your posture. I think it's gonna activate certain muscles and take some back pain away, really. That's really the goal for me, is just to get rid of some of the pain and be able to get through my day without constantly thinking about it. So because I'm so busy and so many people have very full lives, being a full-time realtor, I'm working, if I'm awake and breathing, I'm working. And then I've got twins and a husband and a family and so many things to do. So working out every morning, the thought of then trying to do a whole nother workout for Schroth on top of that is a little overwhelming. So my physical therapist has definitely helped me integrate this into things that I do. So if I'm at yoga and I'm just laying on the floor, I can say, let me start doing some of my breathing. Even sitting in the car or just standing at a networking event, I'm doing things that people wouldn't even know unless, my physical therapist would notice that I'm doing it, but nobody else can see that I'm standing a certain way. So I think it's great that I'm still learning, but I'm trying to implement this into things and multitask. The number one thing is I've gained a lot of knowledge about, I guess, how to fix my posture and change, just make small alterations with things that I'm currently doing every day. So it's loosened up my back a little bit. It's given me something to go to other than just doing my normal stretches. When I leave, I definitely feel much more relaxed. I feel my back actually feels better for at least a day or two, I've noticed. I think overall it's just given me a little bit more flexibility, and it's given me kind of a release when I am having a rough day. I have something that I could try to relax my muscles and kind of get through the rest of the day.
If you're looking for scoliosis treatment, visit ptsmc.com.